The broadcast is now starting. All attendees are in listen-only mode.
Hello, and thank you for joining today's REMI guest webinar, Wild Pig and Foreign Animal Disease Outbreaks, Understanding Spread, Mitigation, and Economic Impacts. This webinar is being presented by Dr. Laurent Liu and Dr. Stephen Schwiff from Texas A&M University Commerce, and Dr. Stephanie Schwiff from the United States Department of Agriculture. Personally, I've been very excited for this presentation. I'm very thankful to our presenters today for taking the time out of their busy schedules to conduct it. The REMI model is the premier software solution for modeling the economic and demographic effects of policy changes. Decision makers and analysts rely on the REMI model to validate their economic impact studies in areas such as energy and utilities, economic development, transportation, taxation, and more. If you have any questions about REMI specifically, I encourage you to reach out to info@remi.com, and we would gladly assist. If at any point during this webinar you have a question, please enter into the question box, and time permitting, I will moderate these questions to the presenters after the conclusion of the slides. If we do not get to your question, I will pass them along to the presenters to reach out to as appropriate. So even if you think that we won't get to it, do feel free to leave it. I also want to let everyone know that shortly after the webinar concludes, we'll be sending a link to your email that contains a copy of the slides and a recording from the presentation. If you have any questions from these materials, please reach out to info@remi.com. I think also Stephanie added her email to the end of this slides as well, and we'll gladly put you in contact with the presenters. Thank you again, everyone, for joining, and take it away, Stephanie.
All right, thank you. Hopefully you can hear me.
Yep, we can.
All right, so thank you, Brian, for the introduction, and we've been looking forward to talking about this and discuss some of the preliminary work that we've done. I have the relatively easy part of going through the background on this, since I'm not sure how much the audience knows about the subject of feral swine or wild pigs. I'll begin a discussion on that, and then I'll pass it off to my father, Dr. Stephen Schwiff, and Dr. Laurent Liu to take us through the last part of it, and then I'll come back and sort of wrap up with some of the information. As you can see from the people involved just in this presentation, this is a collaborative research effort. 3 different government USDA agencies are involved, and that would be Wildlife Services, in particular the National Wildlife Research Center where I work, the National Feral Swine Damage Management Program, and they're the government agency, and I'll talk more about them in just a minute, that's responsible for trying to manage the problems associated with wild pigs in the U.S., and Veterinary Services, who helped us with the epidemiological disease spread modeling and other aspects of this study. In addition to that, we've engaged 2 different universities. As the speakers indicate, Texas A&M University at Commerce. They've been involved heavily on the REMI part, and they'll speak most to that. And then Colorado State University here in Fort Collins. We've engaged not only modelers from Colorado State, but in addition to that, we've engaged, I hire quite a few people, and the lead researcher that I've assigned to this group, Dr. Sophie McKee, is a contractor through Colorado State University. So this has taken a big effort. This was a huge lift to try to model something like this. And we're giving you a high-level view on this, but hopefully it's enough to sort of give an idea of what we've been working on and how we've used REMI as a tool to try to tell this story. I think it's important to talk briefly about the National Wildlife Research Center. The center is the federal institution that is devoted to try to solve human-wildlife conflicts. Human-wildlife conflicts come in a variety of flavors, including wildlife strikes to aircraft, disease transmission, damage from certain things, depredation, wolves depredating on livestock, and high-profile things like that. In particular, at this center, we try to use our scientific expertise to develop methods to help solve these problems in a way that's mutually beneficial to all. In particular, I run the economics project out of the National Wildlife Research Center here in Fort Collins, Colorado. I have a team of economists that work for me, some contractors, and some economists here. And we stay very busy. For those of you who don't know much about wild pigs, the National Feral Swine Damage Management Program funds about 60% of my staff. Wild pigs, feral swine, wild boar, however you would like to call them, they are all the same thing, basically. And they go by a variety of different names. They were introduced to the United States in the 1500s, so they are invasive to this. They are remarkable in their ability to create economic harm and problems of all sorts. The feral swine that we have now in the United States, so the federal government loves to use the term feral swine. Most people use the term wild pigs. Most of the wild pigs that we have here in the United States are hybrids of escaped domestic pigs and Eurasian wild boar. So they've come from cold climates and they have adapted unbelievably well to a variety of climates here in the United States. They are unrestricted geographically, like some other invasive species are restricted geographically, but wild pigs are not. We have them in Canada, and trail cam footage of a sounder of pigs at 40 below. And then we have them down in the southern part of Texas with trail cam footage with temperatures well over 100 degrees. They damage every single crop that we grow in the United States. They either eat it or they damage it because, for example, they damage tobacco because they are interested in the grubs that grow on tobacco as opposed to consuming tobacco. They don't have any natural predators, and they are unbelievable in their ability to depredate on other species, including domestic species and including wildlife. Their ability to damage natural systems either through contamination or their rooting behavior, and then agriculture. They can damage, they consume, like I said, they damage every single crop that we consume in the United States. They will harass livestock, and they can root around and damage fences and cause all sorts of problems for livestock operators. Given their ability to create economic harm, in 2014, Congress established the National Feral Swine Damage Management Program. We've been working with the national program for basically since its inception. And when they first started out talking about managing wild pigs, they talked about the idea of eradicating pigs, and certainly from the United States. And that's really not an option anymore. As we learn more about them and where they are, we know that basically we move into management mode. How do we get to a point where we can reduce the damage that they create to a more tolerable level? And that's where we currently are. But what has happened over this time period, and being the lead economist working on this, I get asked the same question a lot. Everyone knows that they cause significant natural resource and agricultural damage, and we're working heavily on that. But one area that we've lagged behind in telling the story associated with the introduction of invasive wild pigs is the story of what happens if they get some sort of foreign animal disease. And if it was introduced into the United States and wild pigs get it, what are the implications associated with that? In the map there, you can see where wild pigs exist currently in the US, and sort of it gives you an idea of the spread. The spread of wild pigs has been heavily influenced by humans. In fact, most of the northward spread is arguably anthropogenic. So humans moving them into areas closer, like into their county from a different county, so that they're easier to hunt, has been one of the main problems and the main reasons that wild pigs have spread northward. Texas has one of the highest density of wild pigs in the United States. In the world, not just the United States. And so to try to answer this complex question associated with what would happen if a foreign animal disease like classical swine fever, African swine fever, foot and mouth disease were introduced into the United States, it has required not only some significant collaborations, but we are progressing through this stepwise. This is not an easy question to answer. And as I walk you through some of these steps, I can tell you already that we don't have an answer yet to this question, but we're slowly working on it. And the REMI model has been crucial in helping us get there. And so the first sort of step to answer this question has been to address the idea of where would it be introduced in the United States? Would it be introduced in an area where we have wild pigs, so somewhere like California or Texas or Florida? and what disease? Where would it come from? So that was the first step, and the first publication from Dr. McKee sort of dealt with this issue. If we're going to look at the likely routes of introduction, how would that come through? We scanned the literature. We also looked at all sorts of information associated with the illegal entry of swine products, both live and meat products. Then we again begin to couple this information with the density of operations of host species. So where are we producing cattle and swine? Where do we have those operations? And then again, you have to overlap that with wild pigs. Then lastly, if you look at most epidemiological disease spread models, which is not an area that we deal in, we deal in economic models, so we have partnered with epidemiologists to help us with this. No epidemiological disease spread model that we know of right now has wild pigs as an agent in these models. And so right now, what we first did was, all right, where would these diseases most likely be introduced? And we modeled two different things with respect to that. What is the likely place of introduction? And then what would be the worst case scenario for introduction, meaning an intentional, say, terrorist introduction? What would cause us the most harm if it were introduced in this specific location? We wanted to understand those two things and model those in an epidemiological sense. And so we use an epidemiological disease spread model to introduce the diseases in the areas, in particular California, Texas, and Florida, and watched how those models would spread, looked at the morbidity and mortality implications associated with that. Our results suggested that the country of origin from these introductions would likely be China. And like I just said, California, Texas, and Florida would be likely where we would see these introductions. This is where REMI begins to start telling part of our story. We've told the first part of the story is how do we get to where these diseases would be introduced? The second part of that story becomes then, what are the potential economic implications? And what we worry about is, right, it's going to spread domestically. What's the morbidity and mortality implications? And then all of these diseases are OIE, reportable diseases. So the World Organization of Animal Health, reportable diseases, which means it has implications to trade impacts. Likely trade would be shut down. And so we wanted to model those things. Can we model the implications domestically and then model the implications associated with a spread, with a export ban? And so that's where my part stops, and I will pass it off to my father.
Thank you, Steph. So just a little background. I've been working with REMI really since the early 90s, back in the old days of the 5 1/4 floppy disk drives. And so how I sort of got involved in this, Steph and I, in the late 90s, were talking to each other about the economic development work that I'd been doing. And she sort of said, do you think that model might work to help us look at some of these disease issues and animal issues and spread issues? And I said, sure. And that's how we actually got started. So, but we've had a long history with REMI. I think the best thing, because what we do is I wouldn't say it's not unconventional, but it's not the typical application that when you think about REMI that most people think about invasive species and zoonotic diseases. So that's quite a different way to think about using REMI. So for us, the issue, and I guess the best way to say it here, is translation. So what we have to do, and as Steph already mentioned, Laurent Gacalou and I don't do the epidemiological stuff. So we take those spread and that information, we take that from Stephanie's group, okay? And then we we translate that spread into something that some policy variable in REMI, and trying to make that connection between an animal and a zoonotic disease to a policy variable in REMI. So that's the key to it. A couple of issues, and I'll bring up, just end up being important for us. Certainly one of the most important ones is the second one you see here. For us with this material and these issues, the fact that REMI is a dynamic model was exceedingly important because we view these changes in a dynamic context, not a comparative static a context. So that's one of the huge implications for us in being able to use REMI. There are some issues for us because REMI was not designed to look at a lot of agricultural areas. So we have problems of many of the agriculture or those variables tend to be exogenous to REMI and rather than endogenous. And so that's another thing that just leads to some interesting discussions amongst ourselves in terms of how we, and with the REMI, the consultants have been great over the years as we talk through how we do these translation issues with them. So that's an issue. Then also, just so you know, REMI is not a monthly or quarterly model, it's an annual model. So again, for us, in some cases, the impact of this is fairly short term and can be compacted into an annual or translated into an annual context. But in other cases, we can't. So that's another issue that we have to work with in terms of translating what might be a quarterly impact into what might, and for REMI, has to end up being an annual impact. So that's also another issue that we deal with on a regular basis. Now, let me just sort of give you some examples of the specificity of the translation. How do we translate these wildlife and disease issues into a policy variable in REMI? Because we're not expanding a factory. We're not shutting down a plant. We're not building a new plant or things like that. So let me give you a couple of things. One was we were looking and asked to look at the issue of raccoon rabies. And the policy question would be, if you look at the western part of the Appalachian Mountains, government does bait for rabies along that western boundary. So the question became, could we bait less? Okay. And so we looked at that question. And interestingly enough, as you can imagine, there's not raccoon rabies in REMI. So there's not raccoon rabies in REMI. So what we ended up doing is, first, as you can imagine, rabies, by the way, is a pretty vicious disease. So when someone gets rabies, they basically go through post-exposure prophylaxis. And so that engages the person with the medical system, healthcare. People in the United States don't die from rabies. So essentially then what you are doing is stimulating the healthcare sector based on an expectation of an increased human exposure to rabies. So the interesting result, as you might suspect, is it turned out just by looking at the healthcare sector, you get that an introduction of an increase in rabies at the boundary would be positive for the local economy. And of course, that doesn't make sense intuitively. So that's when it was so great about REMI having the new urban economics. And what that allowed us to do is say, yes, you do have the impact on the healthcare sector, but the introduction and an increase in rabies cases makes a region less attractive to in-migrants and less attractive to firm relocations. So when you now adjust using the new urban economics approach is what we did, we adjust for the negative impact of increased rabies exposure, then we got results that intuitively made sense. So that was one case. The second case is that we worked on in Hawaii. And again, it was what would be the potential impact of brown tree snakes migrating from Guam to Hawaii. Now imagine they don't swim. So they would come into Hawaii from on container ships. Now, the question that was important here is, again, REMI does not have brown tree snakes, but there's tremendous tourism in Hawaii for bird watching. Now, what do brown tree snakes like to eat? Bird eggs. And so once then the NWRC estimated the loss of the birds that tourists were coming to see, and then conducted surveys to ask the future tourists, if there were fewer birds, how much less would you come? How much less would you spend? Then basically we translated the impact of brown tree snakes on the Hawaiian economy through the tourism sector. Then FMD is an interesting one, foot and mouth disease that you don't know. And one of the things that we found very interesting was one of the impact through the supply chain was that cattle get moved from sale barn to sale barn, okay? What does that mean? That one of the separate of spreading through the air and separate of a actual terrorist attempt, an intentional spread of FMD, one of the ways that you could look at the spread of the disease was transportation along major interstates in the United States. So that was an interesting, one of the interesting innovations that we looked at in terms of the spread of FMD. And then finally, the one that might surprise you here, looking at feral hog damage. As Stephanie mentioned, the primary focus had been and has been at agriculture and crop damage and that sort of thing. But we also did some surveys and found out that golf courses and cemeteries in major urban areas, where particularly in Texas, where you have a significant number of feral hogs, there was a significant damage to golf courses and cemeteries. And this again, therefore, we translated the feral hogs through golf courses and cemeteries and tourism. One thing that we had looked at and we were hoping to deal with, but we still had a hard time getting the data from the insurance industry, is feral hogs and as a result of traffic accidents. So that's another one that we hope at some point in time down the road, if we can get better data from the insurance industry. So far, they don't teach separate accident data involving only feral hogs. So next slide, please. So now let's look at the modeling assumptions. Generally, we assume that the outbreak lasts about a year. We assume that the government did not indemnify cattle or pork ranchers and farmers for their losses. We assumed, and this is important, a total export ban on U.S. beef and pork for 1 year. And then we further assumed that the killing of the animals was also paid for out of emergency funds from the USDA. So now again, just thinking about how we translated that. So on the culling part, the euthanasia part, what you're seeing is REMI has a section that services. So that's the policy variable we implemented. When you look at disposable, REMI has waste management and remediation services. So that's the policy variable. And then when you looked at cleaning and disinfecting, okay, then that was services to building. So that a specific example of how we took something that was animal related and as best we could translate it into a policy variable in REMI. Okay, next slide. Now, let's look at the modeling assumption in terms of the worst case assumption. We assume that the animal herd decreased by 20% in the second year due to culling in the first year. Remember, you kill animals, that reduces the ability for offspring. So in the second year, we assumed a 20% decrease. Animals that were stamped out exceeds what were exported. Now, beef and pork that were removed from the economy, okay, we based that on domestic values. And the REMI sectors that we used for that, just to show you here, was beef, cattle, ranching, and farming, and then dairy cattle and milk production. Then we looked at what we called add-on value. It's the difference between beef and pork exported and that sold domestically. And this was an interesting issue for us here, because even though the beef that might not have been infected, could be used, we called it the reuse problem, okay? It's not a problem, but the reuse issue. It was not an infected, but OIE banned its export. It could be reused in the US economy. And so what we looked at, okay, and this is the important thing, when you cull the animal, we couldn't cull the animal at the feedlots, because if the animal was culled at the feedlot in REMI, because it's an annual model, then all of the inputs that were used would be wiped out. But those inputs were used. So what we had to do was impact animal slaughtering, rendering, and processing, again, another REMI sector, except poultry and further down the supply chain. Otherwise, we were causing problems. Okay, final slide for me, Steph, next one. So here, oh, that's Laurent, so not me.
Okay, thank you, Steve. So I'm gonna continue with the most likely case. So for the most likely case, the number of animals that are infected turns out to be very limited. So the main issue we encountered while looking at this case is really the reuse issue that Steve mentioned earlier. This is because when animals are not infected, but are not able to be exported, they will be rerouted to the domestic market for domestic use. So in REMI, our key is really how we capture that reuse value. Now, basically, for animals that are infected by the diseases, we did the same thing as the worst case scenario. We impacted beef, cattle, ranching, and farming, dairy cattle, and milk production sectors. Then we modeled the export ban, which means the products that used to be exported will not be exported. So we reduce food manufacturing in international exports. It's not a perfect measure, but that's the closest one we can find among all the possible sectors we have in REMI. Of course, it's the version we use. And then for the reuse part, like I said, the export bounded products will be rerouted to domestic market. So to capture the reuse value, we increase animal slaughtering, rendering, and processing by domestic value, which we assume animals that are not exported will be used in domestic, and they will go through the processing procedure and add value to the economy. Next slide. Then I want to show our results very briefly. We have more tables than what we show here. But the first one is the table for the worst case scenario. We have 3 diseases. As you may recall, we have FMD, ASF, and CSF. In particular, FMD impact 2 type of animals. FMD impact cattle, also impact swine. But ASF and CSF only impact swine. So as expected, we see heavier impact from FMD. In particular, we see a loss of 483,000 jobs and $65 billion in GDP in the first year for FMD. For ASF and CSF, they only impact 1 species, and they're at a smaller scale. The impact is smaller. It's around 14,000 jobs lost and around $4 billion in GDP loss. So this is the worst case scenario. what we can also observe by breaking down for FMD between cattle and swine, we can see that really the impact is mainly driven by cattle for the FMD. So we also show year 2 impact because in REMI, we entered 20% reduction in herd in the second year. Our modeling is for a total of 10 years, but the impact mainly happened in the first 2 years. So that's why we just take the first 2 year results in the table. Can we move to the next slide? And the next one is the most likely scenario. Of course, for the most likely scenario, the number of animals infected will be much, much smaller. So we do see a much smaller scale of impact for this scenario. In particular for FMD in cattle, in the first year, we see 34,000 job loss and $4 billion loss in GDP. What's interesting is that if you look at FMD swine, ASF and CSF, the impact is exactly the same throughout for job loss or GDP or real disposable personal income. And we look at the numbers, we were trying to figure out kind of think why that happens. It turns out that especially for the most likely scenario, the impact, the economic impact is really mainly driven by the export ban because the number of animals that are killed is so small. So the effects from that is relatively smaller. So we don't really see that, observe that much. But instead, it's mainly because of the export ban, we observe all the losses in job and GDP. And in particular, when there's a disease, regardless of what, FMD, ASF, or CSF, we will face a total export ban, and therefore the effect is the same. Now, the FMD cattle is slightly higher than the rest of the three. This is because the number of cattle that in the spread model that are assumed to be infected is higher than swine, and thus the value will be higher when we enter into REMI model, so that the impact from cattle, the impact of FMD cattle is relatively higher. I think that's the end of my part. Gonna return to Stephanie.
Thank you, Laurent. And I'm up to take us home here. So hopefully we gave you a good 30,000 foot view of this project. It's really just sort of a taster of this project. And it's a relatively unique application of REMI. To try to talk to these problems and to try to highlight these issues in a way that's meaningful and purposeful for a broader audience. We know that these diseases are headed our way. African swine fever is literally at our shores, and we know that it's only a matter of time before these diseases get here. And what this modeling helps us to do is it helps us to understand, as we have lots of competition for funding for preventing new diseases coming into the United States, most of which will have some sort of wildlife component, like COVID, like African swine fever. A lot of these high-path avian influenza, again, we're having problems with that right now. And so as we look at these diseases that compete for limited resources, it's often extremely important to not only be able to quantify in dollars and cents and in jobs, basically what is the potential impact associated with these diseases, where are they going to be introduced, but also to examine that wildlife component so that we can understand the implications associated with managing these diseases and understand those sectors of the economy that are most impacted, and that perhaps as we look to manage these diseases, we need to protect the most. We're limited on our ability to manage some of these diseases, and arguably if these diseases get into wild pigs, our ability to manage these diseases is going to be significantly impacted, and the duration of being positive for these diseases in the US will likely expand. And so one thing that, as we look at this, And we started down this initial path. That was surprising for us is, as Laurent mentioned, the implications of these diseases are mostly because of the trade impacts associated with infection. And so it's not that these diseases are going to enter the U.S. and have huge morbidity and mortality implications. Most likely what's going to happen is the trade ban is going to be what hits the hardest and causes the most impact. And so therefore, some of the next steps are going to be to look at the value of regionalization. If, for example, this particular state were to get African swine fever positive animal, how can we cordon off that state and make it so that just that state has an export ban, as opposed to all of the United States or all of the areas in the United States that ship that kind of product or export that kind of product. And so using REMI and having this framework already set up allows us to better understand the benefits and costs associated with something like regionalization and the value of particular types of regionalization. Do we regionalize at the state level? Do we regionalize at the agricultural sector level? All this provides us with more information. And that's one of our big next steps as we move forward, is to look at that. But also, and the whole motivation for this was to look at the impacts if wild pigs become positive. And we haven't done that yet, right? We're just walking through the steps associated with this, and it's taken years to get as far as we have. So the big next step is, how do we characterize feral swine sounder within some of these epi models so that we can look at the impact there and then recharacterize that and remonetize that through something like REMI. So we've got a lot of work to do. This will take a while to get this done, but really appreciate everyone taking the time to listen to the webinar, and be happy to take any questions if there's time.
Awesome. Well, thank you so much, Stephanie, Steve, and Laurent, for the great and very insightful presentation. And thank you to all who have joined. We'll shortly be getting into the question portion of the webinar. So if you have any questions, I definitely encourage you to drop those in the question box now, and then we will get to them. One has come in already, so you'll have some time to type it out. I also want to remind everyone that shortly after the webinar concludes, I will be sending a link containing the recording and the slides from this presentation to your email. Definitely reach out to that info@remi.com email address I've been talking about if you have any questions based off these materials, and I'll put you directly in contact with the presenters. And so, yeah, we'll get into the question that we've received, which is, have you looked at into how higher insurance rates in the areas affected most could cause migration out of those regions?
So not in particular have we looked at that yet. Insurance is difficult when it comes to wildlife, and certainly not for the loss of animals. But since we don't have any positives for these particular diseases right now, there aren't any insurance claims associated with that. But that could definitely be an issue. It is not something that we've looked at in particular or modeled for this analysis.
Great. All right. So that's the only question we've received so far. So what we'll do is, like I said, if anything comes up later to anybody who's currently attended, and if you're looking at the resources that we share, do feel free to reach out. And like I said, I'll connect you with the speakers. Again, I want to thank our presenters very much for taking the time out of their busy schedules to do this webinar. I found it very engaging and insightful. And we hope everyone who attended has a great day and a great week, and we hope that you will come to future REMI webinars. Thank you, everybody. Oh, we got a question. Yeah, well, okay. This always happens as I'm closing out the webinars. What we'll do is we'll ask this question, and maybe more will come. Maybe they won't, but we'll go ahead and get into that now. So, is extermination impossible or just not cost effective? If feral pigs spread is an epidemic, wouldn't it be worthwhile to give it another shot?
Right now, the current philosophy on dealing with feral swine or wild pigs is eradication is no longer possible. There's just too many of them. We like to use the joke that if a sow in Texas has 10 piglets, then 12 survive. We have recognized that in order to impact the population at a population level, you have to kill right around 70% of the population. We don't have a means to do that right now. And the means to do that are incredibly unpopular. So some of the stuff that that is being worked on are toxicants and contraceptives. So both of those are incredibly unpopular to the broader public, but are seen as some of the only ways that will have an impact on the population. They are the world's worst, or pretty much the world's worst invasive animal right now. So we're dedicating a lot of effort to it, but we won't see eradication certainly in my lifetime.
Great, thank you for that. The next question we received is, are you interested in looking at the impacts of FMD to deer/elk venison exports? You talked about beef and pork, but I'm interested how this might be applied to farmed ungulates.
Yeah, and definitely any ungulate can get that type of disease, and so there's definitely an implication associated with that. We haven't incorporated that into our modeling efforts yet, and I don't think in REMI there's a spot for that. So I'm not sure where we would put something like that. REMI sticks pretty closely to your standard livestock, and certainly here in Colorado we have a solid elk market, but no, we have not modeled that.
Great. Okay. And so now probably a question will come in as I'm about to say this, but like I said earlier, we'll be sharing these slides. Feel free to reach out and I'll connect you with the speakers if anything comes up. But again, thank you everybody for joining, and we hope you have a great day. Everyone.
Thank you.